If you are not a candidate for hypoglossal nerve stimulation or prefer treatment not involving an implanted device, you may be interested in pharyngoplasty. I'm Dr. Jordan Weiner, a sleep surgeon in Scottsdale, Arizona. If you've been diagnosed with obstructive sleep apnea and have found that CPAP or other therapies aren't working for you, you may be exploring surgical options. Pharyngoplasty surgeries modify the anatomy of the throat to prevent collapse in the upper part of the throat. A detailed examination of your airway in the office and a drug-induced sleep endoscopy are performed to see if you have collapse in this part of your throat. I go into more detail about the different patterns of collapse in my airway assessment video. If you have collapse in the upper and lower throat, pharyngoplasty can be combined with other procedures. Surgeons have been performing pharyngoplasties since the 1980s. Different techniques have been developed and modified to make them more effective. I will discuss the ones that I consider most important. The oldest and still most commonly performed type of pharyngoplasty is called Uvulopalatopharyngoplasty, also known as UP3 or UPPP. This procedure can be effective in people with anterior-posterior or front-to-back collapse of the palate. It involves the removal of some of the free edge of the soft palate and uvula, as well as changing the shape of the lower edge of the palate. If tonsils are present, they are also removed. As a standalone procedure, the number of breathing interruptions per hour of sleep are reduced by about 50% on average, with most patients being successfully treated in the short term. Over time, however, success rates often diminish. We're not sure why. The soft tissues in the throat may become looser due to scar remodeling or aging. However, UP3 is not effective when there is collapse of the side walls of the upper throat. This is called a lateral collapse pattern. A different procedure called expansion sphincter pharyngoplasty, or ESP, was introduced in 2007 to address lateral wall collapse. With ESP, if you still have your tonsils, these are removed first. Then, a muscle in the side wall of the throat called the palatopharyngeus is repositioned outward and forward. Sometimes it is severed entirely to allow repositioning, and sometimes it is simply pulled by heavy internal sutures. Either way, this expands the width of the throat and reduces sidewall collapse. Success has been reported in over 80% of patients with this type of collapse. The newest variations on pharyngoplasty involve use of what are known as barbed sutures. Plastic surgeons were the first to use this type of suture to lift and suspend drooping tissues of the face. Now we can use them to lift and suspend tissues in the throat to reduce collapse. These procedures go by a few names: barbed suture pharyngoplasty and barbed repositioning pharyngoplasty. The barbed suture pharyngoplasty is often performed with no incisions or tissue removal. The barbed suture is simply used to reposition and tension tissues of the palate and side walls of the throat. This is much less painful than other types of pharyngoplasty. UP3 and ESP can also be combined with barbed repositioning pharyngoplasty. By combining elements of all these techniques, I can tailor the procedure to the type and severity of collapse of the individual patient. Like all surgical procedures, there are risks for these surgeries, although complications are generally uncommon. These can include postoperative infection, bleeding, as well as a long-term swallowing problem where fluid can enter the back of the nose during drinking. Fortunately, this last complication is rare. Occasionally, one of the barbed sutures becomes exposed in the back of the throat and needs to be trimmed in the office. The biggest challenge of these procedures is the recovery. You will have a lot of pain in the throat for about 2 to 3 weeks. Early on, diet is limited to liquids and very soft foods. I prescribe several different types of pain medicines to help manage the pain. After a few weeks, pain decreases and you are able to eat whatever you want. After that, we allow the throat to heal for about 3 to 4 months. Then, a new sleep study is performed to gauge the success of the procedure and make sure we've adequately reduced the amount of sleep apnea. The real beauty of these procedures is that when they are successful, you no longer have sleep apnea and therefore have no need for ongoing therapy. Pharyngoplasty is not for everyone. You may be a candidate for pharyngoplasty if you have significant sleep apnea and cannot tolerate CPAP, have an anatomical collapse pattern that would benefit from pharyngoplasty, you are not a candidate for Inspire or Genio, or maybe you just don't want an implanted device, and you're willing to get through a challenging couple of weeks after surgery. For more information about CPAP alternatives to manage sleep apnea as well as me and my practice, please go to weinersleepsurgery.com.